Intermediaries are trying to solve a complex problem, figuring out how to work with patients and providers in ways that keep them happy and provide needed medical care while also keeping costs low enough. When they do the right combination of both, they set themselves up for success. Every intermediary has to do this in the context of their own specific situation, but they all have to do this in the context of important, broader forces. One of the key ones is constant pressure from high and rising costs. This happens for a variety of reasons. One important one is the arrival of new treatments that can help patients, but are often costly. Research suggests that this has put steady pressure on healthcare costs over time and created challenges that intermediaries find themselves in the middle of. One interesting dimension here is that insurance is probably part of the problem. Economists identify insurance as a factor that encourages people to want more expensive treatments, and thus that facilitates their development and dissemination. When you're insured, you can get costly medical care without paying the full price. This is kind of the idea, to make it possible for people to get the care they need, but then maybe we worry that sometimes people get a bit or even a lot more than they need because it's easily available. So insurance is funny that way. We need it to manage risk and keep the healthcare system functioning, but then it has the potential to turn around and contribute to our cost challenges. This is tricky. New innovations, any treatment really, might be really beneficial, even if it's expensive. We don't want to underuse things, but at the same time, not everything is, and there can be forces that would lead us to overuse care if we're not careful. Intermediaries often find themselves right in the middle of helping us all, society broadly, navigate this challenge. Intermediaries also find themselves in the middle of coping with the challenges of providing high-quality care. Researchers and others have identified general challenges with providing high-quality care, and the challenges grow with the increasing complexity of treatments. Intermediaries are not exactly the ones delivering healthcare, but at the same time, they often take actions that shape the care that's delivered, and when, and how, and where, which can have important influences. We want them to help us cope with the challenges of quality and get this right. And we know that there are challenges with access that can come up. Some of our access problems, particularly in the US, have to do with people not getting good access to insurance coverage at all. That's obviously an issue that involves intermediaries, but it also involves other social and government policy choices. There are other access challenges that can arise too, like making sure there are enough providers in the right places, making sure people with different incomes or cultures or education levels can obtain and use care. Intermediaries often find themselves right in the middle of coping with these kinds of challenges too. Questions about access to care are actually a nice illustration of another dimension of challenges faced by intermediaries. There are times when we want them to help solve broader social challenges and inequalities, some of which have at least some of their roots outside the healthcare system. Now, sometimes they can do that, sometimes it's within their mandate, especially if they're public programs, but we also have to remember that in important ways, intermediaries also can have to function like businesses with budgets and imperatives to manage cost and risks. It's a complicated world that intermediaries inhabit, and a complex set of goals that they have to juggle.